Hello everyone, I am Dr. Vikas Singhal, Associate Director GI Bariatric Surgery at Medanta Medicity Hospital, Gurgaon. So today I would like to discuss about umbilical hernia. That what is umbilical hernia and is surgery always needed for umbilical hernia? So umbilical hernia is a very common problem. A lot of the times you may have noticed that your belly button is bulging out. So of course, you usually would have noticed that there is a difference or a change from previous. This may be a very long-standing problem, which is why sometimes people don't notice until it gets bigger in size and starts protruding more outside or starts giving pain. And rarely it can have complications such as vomiting or an acute pain, fever, those kind of problems. So, essentially, umbilical hernia is a gap in the muscles around the belly button or the umbilicus. This may be present sometimes from birth itself, and over a period of time may have increased in size. It is difficult to pinpoint an exact reason for why somebody develops an umbilical hernia, but this is a very common clinical problem. So then the question comes, that is surgery needed or always needed for an umbilical hernia? So the answer to that is that very small umbilical hernias, less than 1 centimeter, sometimes may not require a surgery. However, any umbilical hernia more than a centimeter or having any symptoms usually needs surgery. So you should consult your doctor, your surgeon, get a proper clinical advice. Most of the times, if you are feeling the hernia, if you are having pain, if you are having any symptoms related to it, or if the size has become bigger, then yes, a surgery should be planned. In the surgery, it is usually done either robotically, robotic assistance, or laparoscopically with small cuts, and a mesh is placed. This is a weak area. So, any hernia larger than 1 to 2 centimeters in size, most of the times will require a mesh placement to support the hernia repair. It's usually only overnight stay in hospital, and within a week you should be able to get back to most of your routine. The only restriction we say after surgery is that for about 6 weeks, avoid lifting heavy weights. So to summarize, umbilical hernia is a very common problem. If you notice a defect or pain or swelling around your belly button area, get advice timely. Most of the times, surgery is required, especially if you are having any symptoms related to it. Thank you.